This presentation is about autoimmune diseases among the Caucasian population. Autoimmune disease affects many body parts such as the brain, eyes, mouth, spinal cord, thyroid, heart, lung, and many more. This presentation is presented to you by Crystal Crane. A brief introduction about autoimmune disease is an autoimmune disorder is the result of the immune system attacking the body's healthy tissue by mistake. Symptoms include joint pain, fatigue, headache, hair loss, fever, and rash. Diagnosis occurs with a variety of many different types of clinical tests such as an MRI, CT scan, comprehensive blood count, C-reactive protein blood test, comprehensive metabolic panel, urinalysis, anti-nuclear antibody test, and erythrocyte sedimentation rate. In Western countries, autoimmune disease affects approximately 5% of the general population. Autoimmune disease most frequently affects women more often than men. However, there are not any known genes discovered thus far that identify the primary cause. A study was conducted among 711 total individuals of Caucasian descent, including their first and second degree relatives. The study aimed to identify the prevalence of autoimmune disease among relatives within the Caucasian population. 85 patients were controlled studies, and the results can be seen in Table 1. Table 1 represents the study that was conducted among the 711 individuals of Caucasian descent. There are many different types of autoimmune diseases, and some of them may include Graves' disease, which is a common cause of hyperthyroidism, which is an overactive production of thyroid hormone, which causes the enlargement of the thyroid and other symptoms. Hashimoto's disease, which is an underactive thyroid, also known as hypothyroidism. Multiple sclerosis is when the myelin sheath that wraps around the axon of a nerve cell is destroyed with inflammation and scarring. In systemic lupus, it may vary widely with the individual, and it may include problems such as a butterfly rash on the face, heart problems, arthritis, organ failure, and hair loss. Rheumatoid arthritis usually affects joints symmetrically on both sides equally, and it may initially begin in only a couple of joints and then spread out widely throughout the body. An antibody is a protein produced by the immune system in response to the presence of an antigen. Antigens may often cause an individual to be predisposed to the development of autoimmune disease. In rheumatoid arthritis, the synovium becomes inflamed and produces excess fluid. This image is an example of a normal knee joint. This is another representation of a normal knee joint. And in this last view, you can see where it points at the inflamed synovial membrane, and this is representative of rheumatoid arthritis in the knee of a patient with inflammation around the knee, and you can see the red inflamed area showing the inflammation in rheumatoid arthritis. There is lots of existing research and literature in regards to autoimmune disease. To best determine the frequency of autoimmune diseases and autoantibodies in families of Caucasian descent, a total of 118 patients were questioned about their family medical history. Specific blood tests were conducted to discover the presence of anti-nuclear antibodies, thyroid antibodies, and rheumatoid factor. Over 25% of patients reported the presence of autoimmune disease in their family history, which included lupus, multiple sclerosis, and rheumatoid arthritis. It has been concluded that the rate of systemic autoimmune disease and autoantibodies is elevated in patients of Caucasian descent and their immediate relatives. Vitiligo is an autoimmune disorder distinguished by white patches of skin and sporadic patches of white hair. It is the most common disorder of pigmentation, occurring in about 0.1 to 2% of people across various populations. Approximately 2,600 participants with vitiligo from the US and the UK were surveyed to determine their similar clinical features, genetic heredity, and association with other autoimmune disorders. Participants were relatively equal across the male to female ratio, and about 83% were Caucasian. The prevalence of 6 autoimmune disorders were discovered, and they were vitiligo itself, autoimmune thyroid disease, pernicious anemia, Addison's disease, lupus, and inflammatory bowel disease. These findings suggest that families with vitiligo and these related autoimmune disorders will be of importance to identify the genetic susceptibility of autoimmunity. Graves' disease has consistently shown an association between specific human leukocyte antigens in controlled studies across Caucasian-based populations. In contrast to this, human leukocyte antigen linkage has been largely negative in autoimmune thyroid disease. The goal of the current study was to examine the role of human leukocyte antigens in autoimmune thyroid disease by observing the associations among families with associated alleles. A total of 99 individuals were studied from Caucasian families with autoimmune thyroid disease, and 135 participants were controlled studies. Genetic testing was performed using a molecular biology technology, which amplifies copies of DNA, which regenerates millions of copies of a particular DNA sequence. Analysis showed an association of Graves' disease in the 99 Caucasian families, although it did not show an association with autoimmune thyroid disease, even in the positive families with associated alleles. Results conclude that the association was most likely caused by a modulating gene, and therefore it was not causative. Strong familial aggregation of systemic and organ-specific autoimmune disease has been demonstrated in previous studies. The present study aims to attain an estimate of the prevalence of systemic and organ-specific autoimmune disease among immediate relatives of patients from Caucasian descent with inflammatory arthritis or connective tissue disease. Over the course of about 6 months, over 600 patients were interviewed and 85 were controls. More than 50% of patients reporting having at least one family member that is affected by an autoimmune disease. The most common disease reported were autoimmune thyroid disease, vitiligo, diabetes, sacroiliitis, rheumatoid arthritis, connective tissue disease, and psoriasis. The prevalence of the disease was significantly different between the relatives of patients and the controls. This data concludes that the high prevalence of an autoimmune disease is particularly high among the relatives of patients affected by autoimmune disease. In Western countries, autoimmune disease affects approximately 5% of the general population. Autoimmune disease frequently affects women more often than men. However, there are no known genes discovered that identify the cause of this incidence. This study aims to review the most recent evidence of possible implications in the role of the X chromosome in the breakdown of autoimmunity. Recent findings suggest that X chromosome abnormalities play a significant role in the development of autoimmune disease. Epidemiologic studies have also shown other factors that contribute to the development of autoimmune diseases, such as strong familial association, epigenetic gene expression, and molecular mimicry. This research has gained the attention of researchers and will implicate future studies to focus on X chromosome deficits and its role in the development of autoimmune disease. Many years ago, autoimmune disease weren't recognized as the public health nuisances that they are often seen as today. More so, autoimmune disease is now recognized as one of the leading causes of death in adolescent women, and a likely cause of this is due to environmental contributors. This review article aims to identify significant environmental factors which have been associated to the development of autoimmune disease. So far, the best evidence linking environmental exposures to autoimmune disease comes from pharmaceutical drug studies. Associations with autoimmune disease have been linked to industrial compounds and chemicals, gluten ingestion, prescription medications, cigarette smoking, high body mass index, and processed foods, just to name a few. Autoimmune diseases are often rare and difficult to diagnose with standard testing alone. This article concludes that the documentation of autoimmune disease is very important to better track the prevalence and progression of the disease. This will help aid in the diagnosis of autoimmune disease and prevent future patients from being treated before the illness becomes too grave. Chronic pain is often a side effect of autoimmune disease, and this is of concern to social workers because chronic pain can play a significant impact on your social, emotional, familial, and workplace environment. This can potentially lead to other unwarranted health issues such as weight gain, depression, withdrawal from activities, and substance abuse. This review article focuses on a project developed to gain knowledge about the experience of people suffering from autoimmune disease and other chronic pain conditions. The project will be subjected to the use of narrative approaches in a group setting among patients with autoimmune disease or other similar conditions. Both qualitative and quantitative approaches were utilized to measure the efficacy of this method. Findings suggest that group discussion through the use of group facilitation helped participants cope with the stresses of chronic pain. Ultimately, a sense of strength and identity were apparent in the findings. Nearly 60% of the adults in the United States are affected by chronic pain associated with autoimmune disease. This article examines the essential need for counseling adults living with chronic pain. Each year, billions of dollars are spent on healthcare costs and other medical-related necessities. As a result, production rates continue to decline, which directly contributes to the loss of income and other wages. Research confirms that the manifestation of chronic pain is connected to the psychological dynamics in each individual. Intervention can be accomplished through the use of treatment planning established by the medical provider. Findings suggest that counseling plays an important role in the treatment of chronic pain. It does so by addressing the individual needs and concerns, directly resulting in an increase of productivity in work and other aspects of an individual's overall state of health. This is an example of the web of causation conceptual model associated with autoimmune disease. Here you will see different determinants such as environmental factors, genetic factors, and lifestyle factors. Some environmental factors are pathogens, pollution, and medicines. Pathogens may include bacterial and viral infection, and pollution can occur in the atmosphere and in drinking water or bathing water. Genetic factors include race, family history, and sex. Lifestyle factors include obesity, mental health, and education. Obesity is contributed to poor nutrition and lack of exercise, and mental health is due to stress and alcohol and substance abuse. And education is also important because if you have a lack of education, you cannot take care of yourself to leave you unsusceptible to autoimmune disease. From the social work perspective, there are various different settings in which a social worker operates, one of these being in clinical practice. Counselors work alongside other medical professionals in order to provide the best overall plan of treatment for their patients. When counselors assist patients with chronic pain and other medical issues, they will often incorporate pain management into the treatment plan using the strength perspective or other appropriate methods. Treatment plans usually occur in 3 different stages. The first stage is to receive consent, and then you will evaluate the patient utilizing the pain stages of change model. The second stage is to consider appropriate measures, administer or refer for proper medical testing, and establish a treatment plan. The third stage is to periodically review the patient to assess safety, efficacy of treatment, medication compliance, all while continuing to evaluate the progress. Here you will also see the pain stages of change model and incorporates 6 different steps. The first one is pre-contemplation, which moves into contemplation, preparation, action, maintenance, and then potentially relapse. There are many different programs within the Department of Social Work at the Hospital of Special Surgery that specifically addresses the needs of individuals with different types of autoimmune diseases. Each program does not discriminate against gender, sexual orientation, race, or ethnicity. It is not specifically targeted towards one group, but to all groups equally. These programs are designed to educate and provide support for people suffering from chronic diseases and the many contributing factors that affect their emotional, social, and overall well-being. Regardless of each individual's needs, these patient support programs can help you cope with a new diagnosis, discover methods of treatment, and help locate other community resources. Here's an example of the different programs within the Department of Social Work at the hospital for special surgery. They have an early RA support and education program, living with RA. There's a lupus line, lupus chat, a systemic lupus workshop, and a lupus network for Asians, and a myositis support and education group. There are many different health-related policies in regards to autoimmune disease, one of them being the Advisory Committee on Immunization Practices. Because autoimmune disease is often triggered by infectious disease, the prevention of infectious disease is so vital in healthcare settings. Committees have been organized, such as the Advisory Committee on Immunization Practices. These types of committees have been organized to implement and practice policies that aid in the prevention of infectious disease among healthcare personnel across the United States. Healthcare personnel are defined as any person, paid or unpaid, working in a healthcare setting that may be exposed to infectious disease, including bodily fluids, contaminated surfaces, air or materials, and equipment. Strict immunization policies and procedures are routinely implemented on new and withstanding healthcare personnel. Vaccines aid in the prevention of life-threatening infectious disease and allow the human body to create antibodies which aid in fighting against live viruses. Many vaccines are required of healthcare personnel and include, but are not limited to, hepatitis, tuberculosis, HIV/AIDS, measles, mumps, rubella, influenza, and varicella. In conclusion, there are over 80 types of autoimmune disease that affects over 50 million Americans. Family hereditary is common among autoimmune diseases and usually affects more women than men. The causes of autoimmune disease are still unclear, but many factors seem to contribute, such as environmental, chemical, bacterial or viral, and chemical irritants have been directly associated. Symptoms may include joint pain, loss of vision, fatigue, fever, malaise, weight loss or gain, and rash. Diagnosis occurs through the use of common medical tests such as blood tests and radiologic imaging. These are the many references used throughout this presentation. And this concludes the presentation about autoimmune diseases among the Caucasian population presented to you by Crystal Crane.